Dr Sanjaya, how far do you think the world is from seeing a global pandemic declared?
I think we're quite closely, but there is a catchphrase which I absolutely love but I can't own because someone else put it up on social media, which is prepare, not declare. So I think even if a pandemic is declared next week or in a month or 2 months, it is important to review our pandemic planning.
And what does that mean for an individual?
I think an individual should take direction from the government as necessary. At some stage it might be, if we are in the midst of a big outbreak, that it might be advised that people have to take children out of childcare, take time off work, and perhaps get extra supplies in case of an isolation period of 2 or 3 weeks or so, such as food and medications.
The Prime Minister's activated an emergency plan for Australia. What does that mean?
Right, so it's based on these 4 principles: prevention, preparedness, response and recovery. But all it really means is that in the event of an outbreak in Australia, we ensure that the sick recover, be that in the community or at home, and that we prevent further transmission. And for that to happen, it involves supporting the healthcare sector in a proportionate response. So that means primary care, pharmacies, making sure there are dedicated testing centres where testing can be done in a safe and efficient manner, and of course hospitals in terms of ward beds and intensive care beds, and stockpiling of medications, of vaccines such as the flu vaccine, and of course personal protective equipment.
If you talk to people who work in the health sector, GPs, people who work in emergency rooms and so forth, they would tell you that on any given day of the week the system is at capacity. How much capacity do Australian hospitals really have to deal with a pandemic here if we got to that?
Look, that is a good question, and of course this plan is proportionate. So even if we do get an outbreak in Australia, it might come in different forms. It might just be a few cases in a few suburbs in Melbourne, or it might be widespread COVID-19 through the country. And of course your capacity to respond would be different. I think there will be a maximal tipping point where, despite good intentions and preparedness and putting in lots of resources, our system won't be able to cope. But let's hope that's not the case.
If you get coronavirus, how likely are you to die?
Right. So we have a mortality rate, or a case fatality rate, I should say, of 2%. But that 2% we're seeing is of confirmed cases. What we know is that there are a lot of people out there who haven't been tested who've had coronavirus. Therefore, the real case fatality rate or death rate is probably well under 1%.
Dr Sanjaya, thank you very much for your time this evening.
Thank you, Lee.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.